Anxiety is a word we hear often. Many people experience it. Anxiety is a natural human response. It is a reaction to stress or perceived danger. Think of it as an internal alarm system. This system is designed to protect us. It prepares us to face challenges. So, feeling anxious is not inherently bad. It is part of being human. Our brains are wired for survival. This wiring includes the anxiety response. When our brain senses a threat, it reacts. This reaction can be very quick. It triggers a cascade of changes in our body. These changes help us to fight or flee. This is often called the fight or flight response. It is an ancient mechanism. It has helped humans survive for millennia. However, this alarm system can sometimes become too sensitive. It might go off too often or react too strongly. Sometimes it even triggers when there is no real danger. This is when anxiety can become a problem. You can learn to navigate these feelings. Anxiety shows up in many ways. Its symptoms can be both physical and emotional. Recognizing these signs is the first step. Common physical symptoms include a racing heart. You might feel your breathing become shallow and quick. Sweating, trembling, or shaking are also common. Some people experience nausea or stomach upset. Muscle tension, especially in the neck and shoulders, is frequent. Headaches and dizziness can also occur. Beyond the physical, anxiety deeply affects our thoughts. You might find yourself worrying constantly. These worries can be difficult to control. They might jump from one concern to another. Catastrophic thinking is also a hallmark. This means imagining the worst-case scenario. You might have trouble concentrating or focusing. Your mind might feel like it is racing. Irritability and restlessness are common emotional signs. A persistent feeling of dread or apprehension can linger. Anxiety can also change our behavior. You might start avoiding certain situations. This avoidance can offer temporary relief, but it often makes anxiety worse in the long run. Anxiety does not have a single cause. It usually results from a combination of factors. Understanding these factors can be helpful. It can reduce feelings of blame or confusion. It is crucial to remember that anxiety is not anyone's fault. Genetics can play a role in anxiety. If you have family members with anxiety, you might be more susceptible. Brain chemistry is another important factor. Imbalances in certain neurotransmitters like serotonin or GABA are linked to anxiety. Life experiences also contribute significantly. Traumatic events such as abuse, accidents, or loss can trigger anxiety. Prolonged periods of stress can also wear down our coping abilities. Chronic illness or major life changes are common stressors. Learned behaviors can also lead to anxiety. Growing up in a household where worry is common can influence us. We might observe anxious behaviors in others. Then we might unconsciously adopt them ourselves. Finally, personality traits can influence anxiety levels. Some people are naturally more prone to worry. They might have a tendency towards perfectionism, or they might be highly self-critical. It is the interplay of all these factors. Recognizing this complexity helps us approach management with compassion. Anxiety is not just in your head, it is a whole-body experience. The mind and body are deeply interconnected. When your mind perceives a threat, real or imagined, it signals your body. This triggers the fight-or-flight response we mentioned earlier. Your sympathetic nervous system activates. This system prepares your body for immediate action. It is a survival mechanism designed for short bursts. But with chronic anxiety, it can stay activated for too long. This constant activation has physical consequences. Your adrenal glands release stress hormones like adrenaline and cortisol. Adrenaline increases your heart rate and blood pressure. Cortisol, the primary stress hormone, increases sugars in the bloodstream. It enhances your brain's use of glucose. It also curbs functions that would be non-essential in a fight-or-flight situation. Over time, prolonged exposure to cortisol can disrupt almost all your body's processes. Mentally, anxiety creates a state of hypervigilance. Your brain is constantly scanning for danger. This makes it hard to relax. It can lead to persistent worry and racing thoughts. Concentration becomes difficult. Memory can also be affected. Understanding this mind-body connection is crucial for management. Section 5. Navigating the Spectrum, Different Types of Anxiety, Part 1. Anxiety is not a one-size-fits-all experience. There are different types of anxiety disorders. Each has its own specific set of symptoms and triggers. Understanding these distinctions can be helpful. It can lead to more targeted and effective treatment. One common type is generalized anxiety disorder, or GAD. People with GAD experience excessive worry about many different things. This worry is persistent and difficult to control. It often centers on everyday concerns like health, work, or finances. Another well-known type is panic disorder. This disorder is characterized by recurrent, unexpected panic attacks. A panic attack is a sudden surge of intense fear or discomfort. It peaks within minutes and involves strong physical symptoms. These can include a pounding heart, sweating, trembling, and shortness of breath. People having a panic attack might feel like they are losing control. They might fear they are dying or having a heart attack. Social anxiety disorder, also known as social phobia, is also prevalent. This involves intense fear or anxiety about social situations. Individuals with social anxiety fear being judged or scrutinized by others. They worry about embarrassing themselves or being negatively evaluated. This fear can lead to avoidance of social gatherings. It can make everyday interactions, like speaking in public or meeting new people, very distressing. Section 6. Navigating the Spectrum, Different Types of Anxiety, Part 2. Continuing our exploration of anxiety types, we find others. Obsessive-compulsive disorder, or OCD, was once considered an anxiety disorder. It is now in its own category, but anxiety is a core component. OCD involves obsessions and compulsions. Obsessions are persistent, unwanted thoughts, images, or urges. These cause significant anxiety or distress. Compulsions are repetitive behaviors or mental acts. An individual feels driven to perform these in response to an obsession. The compulsions are aimed at preventing or reducing anxiety. Post-traumatic stress disorder, or PTSD, is another condition where anxiety is prominent. PTSD can develop after experiencing or witnessing a terrifying event. Symptoms include flashbacks, nightmares, and severe anxiety. People with PTSD may have uncontrollable thoughts about the event. They might avoid situations or people that remind them of the trauma. They may also experience heightened reactivity. This includes being easily startled or having angry outbursts. Negative changes in thinking and mood are also common. Separation anxiety disorder is often associated with children. However, it can also affect adolescents and adults. It involves excessive fear or anxiety about separation from attachment figures. This could be parents, spouses, or other loved ones. Individuals may worry intensely about harm befalling their attachment figures. They might fear being lost or kidnapped. Section 7. Building Your Toolkit, Practical Coping Strategies, Part 1. Managing anxiety involves developing a toolkit of strategies. These tools can help you navigate anxious moments. They can also reduce overall anxiety levels over time. One foundational strategy is mindfulness. Mindfulness means paying attention to the present moment. You do this without judgment. It involves noticing your thoughts, feelings, and bodily sensations. You observe them as they are, without trying to change them. This practice can help you detach from anxious thoughts. You learn that thoughts are just thoughts, not necessarily facts. Another powerful tool is deep breathing exercises. When you are anxious, your breathing often becomes shallow and rapid. This can worsen physical symptoms of anxiety. Deep diaphragmatic breathing can counteract this. Inhale slowly and deeply through your nose. Feel your abdomen expand. Then exhale slowly through your mouth or nose. This type of breathing activates the parasympathetic nervous system. This system promotes relaxation. Practicing deep breathing regularly can help calm your nervous system. Regular physical activity is also highly beneficial. Exercise is a natural stress reliever. It can improve your mood and reduce anxiety symptoms. When you exercise, your body releases endorphins. Section 8. Building Your Toolkit, Practical Coping Strategies, Part 2. Continuing with our toolkit, let's explore more strategies. Challenging negative thoughts is a key cognitive technique. Anxiety often fuels unhelpful and irrational thinking patterns. These thoughts can make you feel worse. Cognitive restructuring involves identifying these negative thoughts. Then you evaluate their accuracy. Ask yourself, is this thought based on facts or feelings? Is there evidence that contradicts this thought? What is a more balanced or realistic way to view this situation? By questioning and reframing negative thoughts, you can reduce their power. Exposure therapy is a very effective approach for some anxiety types. This is particularly true for phobias and social anxiety. It involves gradually and safely confronting feared situations or objects. This is usually done with the guidance of a therapist. The idea is to learn that the feared outcome is unlikely, or you learn that you can cope with the anxiety it provokes. Through repeated exposure, the fear response diminishes. This process is called habituation. Building a strong support system is also vital. Connecting with trusted friends, family, or support groups can make a big difference. Talking about your feelings can reduce their intensity. Knowing you are not alone can be very comforting. Supportive relationships provide a sense of belonging. They can offer practical help and emotional encouragement. Section 9. Moving forward. Embracing understanding and management. Understanding anxiety is the first step towards managing it. We have seen that anxiety is a natural human response. It is an alarm system designed to protect us. However, sometimes this system becomes overactive. This can lead to distressing symptoms and interfere with life. Recognizing the common signs of anxiety is crucial. Knowing its various causes helps us approach it without blame. It is not a personal failing. It is a complex interplay of biological, psychological, and environmental factors. This understanding can foster self-compassion. We've explored how anxiety affects both mind and body. The interconnectedness means that holistic approaches are most effective. Calming the body can calm the mind, and vice versa. We also looked at different types of anxiety disorders, from GAD and panic disorder to phobias and PTSD. Each has unique features, but all involve significant distress. Knowing these types helps in seeking appropriate support. It reminds us that anxiety manifests in diverse ways. There is no single anxiety experience. The good news is that anxiety is manageable. We have discussed a range of practical coping strategies. Mindfulness, deep breathing, and physical exercise are powerful tools.